And what we do, Don, when we're not the one speaking, we usually mute the microphone so that if there's a noise, it doesn't come through. So whatever you're comfortable with, like I said, we can do some editing. But when you're speaking, I usually just turn my microphone off. So if I cough or something, it won't mess everybody up.
I'm here by myself, and it's quiet. Don't have any radio or TV or nothing else on, and but should be very quiet.
Okay, well, I'm going to hop in and start an introduction, and then I'll get you talking, and we'll move from diva to diva, who will ask you those seed questions. And like I said, we sure appreciate it, Don.
All right, thank you.
Hello, welcome to the Compliance Divas podcast. My name is Olivia Wan, and I'll be your moderator today. We are so excited to interview a retired OSHA health consultant supervisor. As the Compliance Divas, we bring clarity and simplicity to compliance by navigating regulatory compliance to keep you on course. Please subscribe to the Compliance Divas podcast through your favorite podcast channel or on our website, thecompliancedivas.com. Resources we mentioned during the podcast can be found on the Compliance Divas website. You may also submit your questions to support@thecompliancedivas.com. So Don, once again, we are so excited to welcome you to our podcast and to let our listeners learn more about safety from the perspective of a professional like you that handled safety and managed audits. So let's get started. Please tell us a little bit about yourself, Don, and what you did for OSHA.
My name's Don Hall. I live here in Murfreesboro, Tennessee, and I worked with OSHA for 18 years and 3 months. And it got to the point I thought, well, I think I'm going to just retire. I was of the age and everything, and so I thought, well, I'll do that. And but I went to Middle Tennessee State University, where I earned a bachelor's degree in industrial management, and then I went on to earn my master's degree in industrial safety. I started out as OSHA compliance officer, and I did that for several years, and I was promoted up to health compliance officer, supervisor. I did that for a few years, and then I had an opportunity to transfer over to consultation. Consultation is a little friendlier atmosphere than compliance. Compliance, you just show up at a company and you conduct an inspection, either because they were on a highly hazardous list or a complaint that an employee filed. Consultation, you're invited in by the company owner or manager to help them with their programs, make sure that they are in compliance in case they just make sure they're working safely and following the compliance rules. And it's a little friendlier atmosphere on the consultation side.
So Don, talk to us about Tennessee's local emphasis program that affected dental offices. When did that start, and what is a local emphasis program?
Well, I think it's about every 2 years they come up with the compliance officer compliance manager comes up with a special emphasis program. Like 1 year we did lead, and just it'd be different things. So we went out and sampled for lead. Any company that might have had employees exposed to lead, we'd try to go out and do an inspection there. So to come up with that, there was a lot of citations written at dental offices, and so they decided, hey, we need to have a special emphasis program for our dental offices. So that lasted, I think, about 2 years, 2.5 years, and before they moved on to something else. And it was because that they were getting a lot of citations, and didn't have a lot of injuries, but just the citation. And basically, it was documentation and programs that a lot of the dental offices, most of the dental offices that I went to, were following the rules and regulations, except for, I mean, they were doing the right thing, but they weren't documenting. That was the biggest problem.
So Dawn, I'd like to have Mary have an opportunity to ask some questions. Mary, what's on your mind?
Oh, I have lots of questions, and thank you again,
Oh my,
Dawn, for joining us. So
yes.
can you give us a kind of an estimate of how many dental practices that you audited in your time? And how do you think that dentistry compares to other healthcare settings like nursing homes or medical offices or hospitals? I like the encouraging news that you said people were doing the right thing, but not documenting. So how do we compare to other settings?
Yeah. Well, most of the medical places I went to were doing the right thing as far as, but maybe documentation wasn't quite up to par. They didn't do their training, or they didn't get people to sign off on certain documents. They may have something else that I noticed was that they would get a program like a hazard communication program in, or a bloodborne pathogen program in, but they didn't complete it. They just bought the program like off the internet or something, and they put it in a book and put it up on the shelf, and they just didn't complete the paperwork. And I said, well, this is kind of like not having one, because you didn't do you just put a notebook up on the shelf. You didn't actually complete the requirements there.
Oh, Don, you just validated our experience with our clients, that they buy a manual that is meant to help them be in compliance, but they don't take it out of the shipping box. They don't take it out of the shrink wrap, and they put it on the shelf and think they're compliant. So it's not just
Yeah, I ran into that several times, and I ask them for their programs when I go in to visit them, and I would say, and they would bring a book out to me. I said, well, yeah, but you've got nobody's name in here. You don't have any dates or signatures or anything like that. So you really don't have one.
So Don, let us know, how many dental offices have you inspected over the years? Do you have a number?
I'm going to guess around 200. I think we did for the special emphasis program. I was doing that for about 2.5 years, I think, and probably in the neighborhood of 200. And probably it could be a few more or a few less, but somewhere in the neighborhood of 200. We first started out. We tried to get the dental offices to give us a call in consultation, because hey, it's a free service. But they didn't want anything to do with OSHA, because they thought they were going to get on a list or get inspected or get a citation or a penalty. I said, no, it's a free service. You won't get any penalties or citations. All you have to do is, if we find any hazards, just correct them and let us know what you did to correct them. And but after this emphasis program, special emphasis program got started, compliance started going out to some of the dental offices, and they wrote up some citations, and some of them got some penalties, and so the word kind of got spread around the dental offices, because they would have their local meetings, with the dentist, and word got out, said, hey, compliance is coming out, and you get citations and penalties, but you can call consultation, and you won't get any. So that's when we started getting a bunch of calls and a bunch of requests, and that kept me pretty busy, and it was good work. I enjoyed doing it, but yeah.
So Don, let me ask you one more question before Linda interviews you. When a voluntary consultation is conducted and the changes that OSHA outlines are not made, what happens then?
Well, just say I'm set as a consultant, health consultant. I would go to the dental office. They would invite me in. I would go in. I would review their programs. I would interview their employees, the dentists, the assistants, and the hygienists. And I'd ask them some basic questions like, Have you been trained on bloodborne pathogen? Or what about where's the hazard communication program? What kind of personal protective equipment do you use? Have you been trained how to use it properly, and things like that. I lost my train of thought there.
No. So circling back to that thought, if there's a voluntary consultation conducted and the violations are pointed out for changes to be made, what if a dental office does not make those changes?
Okay. We give them every opportunity to do that. I remember when I first started in consultation, one of my first places I went to was not the dental office, but I wrote up like 30 hazards. And they were having some difficulty, and we worked with them for almost a year before we got them to submit what they had completed and how they corrected these hazards. So we work with companies. We tell them, and they agree to this. We tell them before we come in. I said, hey, if we find any hazards, serious hazards, violations, then you agree to correct them and let us know. So we will send them a report, what we found. We'll tell them what we find when we're there, but we will send them a written report, let them know, hey, and they'll be listed like 1A, 1B, or 1C, or like that. And they'll have a form to fill out to send back to us and say, hey, and we don't really ask for any documentation. That we just take their word for it. But they would let us know what they did to correct it. Say we wrote them up for not having a hazard communication program. We have now completed our hazard communication program, and it's on file, and the employees have been trained. And just let us know what they did to correct the hazard.
Thanks
if
for
they
that.
do not, yeah, and let me expand on that a little bit more. If they just simply refuse, the 18 years that I was, 7-something years I was in consultation, I had one customer, one client that just would not even do it. They wasn't a dental office, but they just wouldn't complete the form and send it back. So we had to turn it over to compliance, and then they handled it. So then they're going to get citations and penalties probably. With us, we call them hazards, and compliance calls them citations. Citation, compliance, you can get a penalty with it. On the consultation side, you do not get a penalty. You just have to correct the hazard.
Great information. I know that Linda Harvey is anxious to ask you some questions as well. Linda.
Bonnie, welcome again. So I wanted to ask you a quick question. You mentioned that dentistry had a history of citations there where you are. And so besides the documentation that you've mentioned, what was the next most common violations that you identified in dental practices?
The training, the actual training, where you maybe sit down with your employees and go over what a bloodborne pathogen program is, a hazard communication program, personal protective equipment. Have you been trained on these? And get them to sign off on it and date it, and then keep a record of it. My personal dentist, I won't mention his name, great guy. He's been in business for 30 years, and he had a core group of people, about it's a rather small dentist office, there's 4 or 5 people there, and they were all been together for years, and they were doing the right thing, but he did not have any paperwork at all. And I think I wrote up maybe 35 hazards at his office, and he did a great job, and he put all the programs together and signed off and trained all these employees on what they needed to be trained on, and they signed up and documented everything. So,
Don, I'd like to ask you a quick follow-up question on that. When you talk about training, how did you all feel, or did you notice if there was a distinction between whether a dental practice or any employer had a training roster versus just having like a CE certificate that they went to a course?
Most of them, they just did in-house type training. Some of them, the larger dental offices, like maybe there was a corporation where they had maybe a dozen dental offices, and they had the headquarters would have programs together that they do online. But yeah, it's mostly like the smaller offices, just the individual offices, they would do online training. Like we had programs online for TOSHA, bloodborne pathogen, personal protective equipment, hazard communication. They could get their basic training there and then go over some site-specific parts of the program in-house.
That's great information, Don. Thanks for sharing that with us. And Leslie would like to speak to you to highlight a few other questions that she had. Leslie.
Well, hi, Don. I was very curious to know about what kind of documentation violations you might have seen, and what are people forgetting to document when it comes to OSHA?
I'm like specific, like who did the training? Well, they're supposed to put the name of the person who did the training and their qualifications. And seems like there may be one more item there that they need to put, but just basic information, like, yeah, we've been trained on this, and they signed their name and date it, or they just signed their name and they didn't put any date on it. So it's really, you know, they need to be a little bit more specific in their documentation, like the person doing the training, what qualifications, say, hey, if the dentist did the training, put I'm a dentist or a doctor so-and-so, or they have a bachelor's degree or a master's degree, or maybe they're certified in some area. Just put their qualifications and the dates is the main thing.
Well, another thing I wanted to ask you about, I had heard this at a meeting I recently attended where someone from federal OSHA had said that it was important that the position of the person that is being trained is listed on that sign-in sheet. So is that something that you felt was important to have too? Like,
well, yes, and that is one of the requirements. You're supposed to put the person, like if they're a dental hygienist, put on there, I'm Mary Kay, dental hygienist, or Susie Smith, dental assistant, or put the dentist. And some of the dentists kind of felt like, well, I'm a dentist, I don't really, but they need to be trained as well. Even though they've been to school and they've been educated and they've got the experience, everybody's supposed to go through this. And most everything is an annual training, so you have to do it every year. So,
I just had one more question, because I get asked this a lot. While someone might not be a dentist or a hygienist or have a master's degree or bachelor's degree, a dental assistant in many dental offices is usually in charge of infection control and well acquainted with bloodborne pathogens and hazard communication. And so a dental assistant who is familiar with the work site that has enough information could actually provide that training. They don't need to be a dentist or have a degree. Is that correct?
That's correct. Yes. Just put on there what position they hold with the company, or if you're bringing in an outside consultant to do the training, that's fine too. Just be sure and put their name and position and on the paperwork there.
That's wonderful. That gives opens up the opportunity for just about anybody in the dental practice to be the OSHA coordinator. And I know from personal experience, when I joined a practice, I was low man on the totem pole, so they gave me that title right off the bat.
Yeah. And, yes, I've been to those offices, and okay, she's been with us for less than a year. She's the newest person here. She's in charge of our OSHA programs here now. Okay, and that was fine, but a little bit more opportunity to learn when you actually given something. I found out that if you're teaching something, you learn more than, or I learn more than just when I'm sitting there listening to somebody.
I have to give a boy howdy to that. You absolutely do learn more. The teacher becomes a student in many cases, especially with evolving science and data surrounding infection control and other infectious diseases. So another question, Dawn, for you. With regards to policy, is there a policy related OSHA violation that you see frequently in dental offices? Like, for example, not having a policy surrounding the proper PPE or hand washing. Can you share with us your insights on that?
Well, from my experience, I've run across companies, either they seem to have most everything that they were supposed to have, or they really didn't have anything. And you know what I mean? It was kind of like yes or no. I mean, and far as just the basic things for basic programs for dental offices, like the bloodborne pathogen program, the hazard communication program, the personal protective equipment hazard assessment program. I think that's basically all you need, and so.
Okay, well, that gives me a pretty good idea. I picked up something like all or nothing. And so that's probably rings true for a lot of dental practices. They're either doing it all, doing it correctly, proud of it, willing to have anybody look at it, including an OSHA consultation, or they're doing nothing and afraid to partake of the free and valuable service that OSHA can offer. And so
Yeah.
I heard you loud and clear when you were saying that you actually, the consultation is actually the good guys, and you try to help these dental practices
Yeah, I mean,
get compliance.
yes, I remember my first visit was well, the first thing they call consultation, we call them visits, and compliance they call them inspections. Basically doing the same thing. But my first visit with consultation was I went to a place and I spotted all these hazards and I wrote them up and I sat down with the owner. And I thought, oh boy, he's fixing to get mad right now because he's going to hear all this stuff. And I went over it in a consultation and I explained to him. I said, hey, and at the end, he said, thank you. I appreciate you coming out. I said, okay. So it's a real different atmosphere from compliance to consultation. I enjoyed the consultation part much more than the compliance part.
I bet you did. Thank you, Don.
Thank
So
you.
Don, one thing for sure, TOSHA made me really busy those years here in Tennessee when they were actively auditing and walking into dental practices. So we really,
right.
your work. I know that Mary has another question for you, Mary.
Okay.
Actually, I have two questions for you. The first one is related to having all the documentation that is required from OSHA in electronic format. There seems to be this myth out there that OSHA requires hard copies of everything. And so practices are a little bit reluctant to save things electronically, even if everybody has access to it. So kind of give us your view on that.
You're absolutely correct. They do not have to have a hard copy. They just have to have access to it. Now, you might consider, okay, well, what if my computer goes down? And well, then maybe it wouldn't be. I always tell them it's not a bad idea to have a hard copy, but it's not required as long as employees have access to it.
Okay, great. Well, one of the examples that, or the things that I see a lot of people question is access to safety data sheets. And
right.
When people have paper safety data sheets, usually they're in a big binder, they're not alphabetized, they just pull them out of the package, they throw them in the binder. And so it's very difficult
and you can't find them.
to find one. Yeah.
Yeah, you can't find them when you need them. So they need to, and we don't. There's not a specific regulation that says you have to put them in alphabetical order or anything, but they really do need to have access to them. I mean, if you had some type of chemical splash in your eye, you don't want to have to thumb through 1,000 pages to try to find the one that hit you. So I always recommended to people that were in charge of the safety data sheets, if you're going to have a hard copy, try to put them in some kind of system that you know where to look, when to look, and how to find these as quickly as possible.
Exactly. Well, and one of the things that I recommend too is that, and you mentioned it earlier, what if the computer's down? And so I've got these electronic copies, but it happens to be that the computer's down and now I need a copy. But in my experience, pretty much all the manufacturers of products have their safety data sheets on their website. So if someone's got a smartphone or a tablet, they could easily access that information, even if their system was down, so they couldn't get their file. Would that be acceptable?
Yes, yes. And also, I forget exactly, you have a time limit. I forget if it's 4 hours or 24 hours, or say if the compliance showed up and they asked you for a program or something, you have a certain amount of time to get it to them. And I forget exactly what it is, but employees need to know where the programs are at. I remember going into a large hospital, and during the process, I was interviewing one of the nurses there, and I said, "Well, where is their bloodborne pathogen program?" And she just pointed to a shelf over there, had a lot of books on it, and I said, "Okay, can you go over there and pull it out for me and show it?" And she walked over there and kind of looked around, and she says, "Well, no, I don't know where it's at." I said, "Okay." So I spoke to the manager and said, "Hey, you need to train people a little bit better." So we write them up for training, and of course, all they have to do is report back to us. Employees have been trained on this certain subject, but they need to know where the programs are and know just at least the basics. They don't have to have all the hazards memorized or anything, but just know the basics.
Okay, great. Well, we heard you loud and clear about documentation, how that seems to be lacking, and making sure that we have training documented and safety plans and so forth. Are there any other practices or protocols that you think could be done better?
Well, basically the training, the documentation, the training. I remember another dental office I went to, a fairly large place, and I was there right around noontime, and I was speaking to the manager, asking some questions, and they had a lot of windows, and I saw 3, 4, 5 of the dental assistants, hygienists, they were all leaving. I said, "Where are they going?" "They're going to lunch." "They can't go." They had their smocks on, their lab coats and everything. I said, "Well, they can't wear that out to lunch like that, because that's part of their personal protective equipment. They need to take those off and hang them up somewhere." So you run across things like that every now and then, but
Okay. What about things like sharps containers? What do you look for compliance with the use of sharps containers in dental practices?
they're convenient. They're supposed to be like one in each room where they have sharps disposable. They're going to dispose of the sharps. Like if they're using the needle in every room they need to have a sharps container in every room. I have run into places where they just had, "Well, we just have one. It's in the lab." I said, "Well, no, you're supposed to have it at a very easy to get to location. You can't be walking down the hall through doors and to get to the disposal." And most of them did pretty good. I've run across that a few times where they didn't have enough, or I have run across a few of them that were overfilled, because that fill line is kind of low. I'm one of those people. I'm going to use every inch of the space I get. So, but you can't cram them in there and jump up and down on them and everything. So, do not go past the fill line, and just have them at a convenient, easy location. You can't have them. I've run across some places that had them underneath a cabinet, and it specifically says you can't have them where you have to open a door to get to them or something like that. So I went to one place that was, they did cosmetic work, and they had, "Well, we don't want to leave them out there and it's a fairly nice, fancy place, and they, "Well, we don't want to leave them out so our clients can see them, I said, "Well, at least you got to have the door open when you're doing the procedure, so you can get to it easily. You don't have to open the door to get to it." So.
Okay. And then if the practice had perhaps one that was inside a cabinet, but there was an opening cut into the countertop, then they could drop them through. That would be okay.
Yes, that's correct. That'd be
All
great.
right. One last question, and this is one that commonly comes up with dental practices, and that is about transporting their contaminated instruments. And we're well aware that the bloodborne pathogen standard states they have to be transported in covered, puncture resistant, leak proof containers, but we see as consultants a lot of lack of compliance with that, where a dental assistant, for example, may carry the instruments loose on a tray from the treatment room across the hall to the instrument sterilization area. What kind of words of wisdom can you give us about that, about how we transport those instruments?
Well, you were correct in everything you said there at the beginning about it's supposed to be leak proof and it's supposed to be covered. Also supposed to be labeled biohazard. And but yeah, and I thought a lot of it, just to kind of from a personal point of view, that well, it's kind of silly because the person that was taking them from the dental procedure area right across the hall to the decontamination area is the person who's going to be cleaning them. And do you really need to do all that? But the regulations say, yes, you do need to do that.
Thank you for that clarification.
Okay,
Don, I'd
thank
love
you.
to have, excuse me. Don, I'd love to have Linda ask a follow-up question if she would.
Okay.
Thank you, Olivia. Don, you've mentioned a couple of times the citations versus penalties that you've seen over the years. And I would just like you to see if you could draw a connection between what happens and happened in the past, during your tenure in TOSHA to the federal OSHA, because we have listeners across the country. And I think it's important that they realize that what happened in Tennessee or happens in Tennessee isn't just a standalone situation. This is things that apply nationally. That's correct?
Tennessee is a state-run program. You have an option. Each state has an option. You could either be run by the federal government or you can be run by the state. The state has to be as stringent as the federal government, and even can throw in a few extra things if they like. But we have to be as stringent as the federal government. From what I've understood about, been in some meetings, that a lot of times the federal government may issue these huge penalties, but then they'll give you a big reduction in the actual penalty. So Tennessee is pretty much, it is what it is. If you get a penalty for $1,000, it's pretty much going to stay there. They might give you a little bit off if you go in and you state a good reason why something occurred, and they might give you a reduction in that penalty. But it's basically, but they give you this is on the compliance side. They give you a reduction for the size of your company. I believe penalties now are $7,500 or in that neighborhood. Is that correct? Do you remember, Olivia? But anyway, you might get 30 or 40% off for the size of your company, another 10% for good faith, and it ends up it's not going to be anywhere near $7,500. So they try to work with you. They're not trying to put you out of business. They just want to get your attention, and so you won't do it again.
That makes perfect sense, Don. Thanks. I wanted our listeners to recognize that even though, like you said, Tennessee can have some stricter things than the federal government, it's all predicated on the same premise. It has to be at least the federal OSHA, as strict as federal OSHA.
Yes.
So all things that we talk about today apply everywhere, essentially.
Yes, we have the same rules and regulations as the federal government, but we have a few extra. I think one that sticks in my mind is the hazard communication program. It just says that on the federal level, people have to be trained, and on the state level, they have to be trained annually. So I think, and just a few things like that. So.
Thank you, Don. I realize that with the local emphasis program in Tennessee, it really helped. I know a lot of my clients are in Tennessee, but it really helped to get across to our clients and to dental practices that they need to be audit ready, that whether they scheduled a consultation or there was a random audit or it was complaint driven, that dental practices need to be what we call audit ready. And I really appreciate the working relationship that we've had with TOSHA. And I know the Divas really appreciate your time and letting us ask you these questions so we can reveal to our listeners what are key things that OSHA would look for if they came into their dental practice. So we do appreciate your time, Don. As the
Thank you.
Compliance Divas, we bring clarity and simplicity to compliance by navigating regulatory compliance to keep you on course. Please submit questions to support@thecompliancedivas.com. Any resources that we mentioned, we will make them available on our website. So once again, Don Hall, thank you for joining us.
Thank you. I appreciate it. I enjoyed the time we spent together. Thank you.